Hi, I'm Valerie Hellerman, and I'm the project manager for the Tibetan Children's Education Foundation, and we're on our way back to Zanskar in the Northwest Himalayas on a medical service trip. I'm really excited about this trip. In 2014, our foundation was invited to Zanskar to assess the healthcare systems. What we found is that in this very remote region of the Northwest Himalayas, the healthcare was just unavailable, mostly due to the topography. This is the highest inhabited area in the world, and they're isolated 6 to 7 months of the year just due to the weather. So healthcare is really an issue. So while we were in Zanskar, we were granted an audience with His Holiness the Dalai Lama, and during that audience, he told us that if the Chinese policy continues as it is in Tibet, that Zanskar will be the last authentic Buddhist culture, and that we must continue our work. So we were a little overwhelmed, and the next day we were whisked away to the Zanskar Himalayan Health Committee meeting, and we were invited to several others that we attended, and found out that the Dalai Lama had granted Zanskar money through the Dalai Lama Fund to build a hospital for both Western and traditional medicines. That hospital has been constructed, and we have been invited to come and open the hospital with bringing medical camps. So we're bringing 3 doctors and 5 nurses, 2 massage therapists, and some ancillary people to deliver healthcare in Zanskar. We're really excited about this. Some of the things that we're going to be doing, Dr. Vicki Chapman from Great Falls, Montana is a gynecologist. She's going to be doing a women's health clinic. That clinic will involve cervical cancer screening and colposcopy. Now, just as an aside, cervical cancer is one of the biggest killers in developing countries and in India. And if a patient is even treated once, it reduces their risk of dying of cervical cancer greatly. So that's a really wonderful thing that we'll be able to do. We're going to do a pediatric clinic. Dr. Mark Ibsen, who's an ER physician, will be coming, and he will be screening children for heart issues. Due to the high altitude and premature births, there are many heart defects, congenital heart defects in children. Also due to the untreatable streptococcus infections. Now here in the West, if your kid has a fever and a sore throat, they go to the doctor, they get antibiotics, their strep is treated. Their untreated strep goes into rheumatic heart disease, which then can cause rheumatic fever and valve problems, and it's a major heart issue for everyone in that area. So we have a, all right, Kat, that was just too much.